who's taking the time to be part of this webinar today. It is such a great opportunity to reach out to everyone, and we're so thrilled to be able to do this as often as we do and bring sort of information that may not be in the mainstream or possibilities to provide care and assistance to patients across the spectrum. So this is a real true honor for me as well. And every part of what I do to support the Accessible Pharmacy team has been really the best work I've done in my life. So getting that out of the way, let's talk a little bit about genomics and medication management. The appropriate use of prescription drugs begins with selecting the correct agent. For the most part, prescribers utilize a series of guidelines that have been established via large demographic studies. These results are established over time, and for the most part, they really look to grab a large percentage of efficacy, or a high batting average, if you will. So when you say that, boy, this drug is 75 or 85% effective in treating most patients, that's a really good thing, unless, of course, you're the other 10 to 15%. And then maybe it's not such a good thing. So the process itself often necessitates a trial and error of agents and dosing to achieve the desired effect. And during this adjustment period, the patient may be exposed to unnecessary side effects and a bunch of drugs they may not need, and loss of time and quality of life, and frankly, even money that they pay for the drugs that may or may not be the best ones for them. So you might be thinking, is there a better way to select medications? Maybe a way that's a little bit more personal or specific to each patient's needs, as opposed to that 75 or 80% that are mostly, affected well. The fact is, there is a way to make drug selection more precise. There is a way to determine what medications are best for an individual using information gained by their own unique genetic makeup. That way is by incorporating pharmacogenomic testing and monitoring, also known as PGX. Pharmacogenomics, or PGX, is the science of how personal genetics affect drug response. The term itself, pharmaco and genomics, is the combination of pharmacology and genetics. And PGX analyzes the genetic makeup of a patient's ability to utilize medications and the effects of their response to the drugs themselves. PGX aims to optimize drug therapy, achieve the best results while minimizing side effects, preventing the most possible adverse events, and really providing the patient the shorter distance to gain the outcome desired, thus improving their quality of life and decreasing the time it takes for them to feel better. By using genomics to guide drug selection, we can avoid the one-size-fits-all mentality that's usually utilized, and eliminate some of the trial and error in prescribing, allowing physicians to take in consideration the patient's personal genes, the functionality of these genes, and how it affects the efficacy of the patient for their current and even future medications going forward. We're going to talk about that in a little bit of detail in a moment. It's important to consider this. Not only are we able to use pharmacogenomics to assist with issues that you're faced with right now, we're also able to take the knowledge gained to provide guidance going forward. We can, in fact, have a plan specific to each patient for a number of issues that they may face in the future. This is one of the many benefits of PGX. An individual's genetic makeup doesn't change over time. We are who we are today and for the rest of our lives. That's part of the beauty of PGX. You only need to perform the test one time. So once we have the information, we're able to use it to guide the choice of medications for any new necessity going forward. In fact, it might even be possible to use PGX to look back at previous drug selections to explain why they worked or maybe why they were a failure. So you're probably wondering, how do we get this information? How does someone find out what their personal PGX makeup is? Well, the fact is, PGX is a laboratory test, similar to a number of tests performed by a diagnostic lab. The PGX test itself is non-invasive. There's no blood to be drawn. There's no finger prick. It's a very simple swab or a large Q-tip that's rubbed on the inside of your cheek, and some of the cells that are loose are then put into a solution. The solution is sent off to a lab. After a short period of time, the lab has the results of your personalized genomic makeup. Now, the results reveal different enzymes that are created in your liver that your body uses to break down medications to their active form and also to clear the medications from your system once they've had their effect. It's these processes that we use to determine which medications to select for you, because if you're lacking a certain enzyme or if you don't have enough of it to break the drug down to its active form, then the drug's probably not going to work for you, or at least it's not going to work as well as another drug could. A drug that would be more specific to your personalized enzymes. In the same respect, some of these enzymes are utilized to break down the medication and clear them from your body once they've done their job. If you're not able to clear medications and move them out of your system, you may accumulate side effects, and they may be more significant adverse events if you simply choose than if you would simply choose the medication that's more specific to your personal makeup. The results of the test are kind of widespread in terms of the variations of your personal enzymes. There will be results that have very useful information to examine the medications that you're currently taking. And there will be also results that we can have in the bank, so to speak, so that going forward, any kind of new challenge that you would have or a new diagnosis could be treated with medications that we know are more specific to your genetic makeup. As we said earlier, once we have the test, we can create in fact, a blueprint of what to do now and what to do in the future. And so it's really a thought process that you can move forward with this test, not just for the moment that you have the results, but then again, if you're faced with something new. This is where accessible pharmacy services come in. Our clinical experts know exactly what the results of the test say about you and can provide very useful information when it comes to drug selectivity, and in fact, help you and your prescribers make the best choices today and for the rest of your life. So a lot of you might be thinking, wow, this is really exciting. This is amazing. And it is. The fact that we can utilize your particular genetic makeup to guide the selection of medications can be more accurate and limit the unnecessary side effects and potential adverse effects is a breakthrough. This is all true, but having said that, it's not every drug that is affected by the enzymes in the PGX test. There are a number of drugs that have no PGX relevance whatsoever, but the ones that do are incredibly important and can be really very problematic if they're not utilized in the optimum manner. Some of the medications that benefit from PGX testing are those that we use for blood thinning, those medications that we would use if someone were at risk for a heart attack or stroke. These are particularly difficult medications to manage, especially if you're in crisis. So utilizing PGX for this kind of drug can be of great benefit and value to both patients and prescribers. But PGX is also effective in making selections for other issues that may not be as significant as thinning your blood, but frequently experienced by large populations. An example of these drugs are statins. Statins are used for cholesterol, and they all have PGX relevance. And while a statin isn't as necessarily concerning as a blood thinner, many people use them every day to prevent high cholesterol from having an effect on your heart and other things going forward. Drugs used for reflux, called proton pump inhibitors, also have genomic significance. And again, not as challenging as blood thinners. Many people take these medications, and because of that, they may be experiencing unnecessary side effects or poor drug performance because they simply don't have the genetic makeup to use the drug they've been prescribed. And it can be very unpleasant to have reflux. It can be very unpleasant to have those side effects. So it might be a good idea to know which drug works best for you. But of particular interest in regard to the use of PGX testing is to assist in the selection of drugs used for behavioral and mental health, as well as pain. Pain control is a very hot topic these days. The whole world would like to do better at this. The misuse of pain medications can cause tremendous issues with patients' lives. Dependency, diversion, waste are all considerations when choosing a pain medication. If you have a genomic test on board, prescribers can narrow the choice of pain medications from the very beginning to avoid the kind of poor selectivity that may lead to adverse effects, that may lead to what looks like drug dependency or the misuse of pain medications when in fact it was simply the wrong choice from the beginning. And even if you don't have the need for pain control today or at the moment, and you've had genomic testing because you're interested in how it would affect your other medications, like for heart or some other issue, you'll know exactly what medications are the right ones to choose if you ever, in fact, did need pain medication. If you ever were faced with a surgery or some other kind of injury or just pain that comes about from the breakdown of soft tissue. I spoke earlier about using PGX to guide the selectivity of medications in the area of cholesterol and statins and reflux with proton pump inhibitors. But in many ways, it's relatively easy to determine if these medications are in fact working and resulting in unnecessary side effects. If you're using a statin, we can measure your cholesterol. That's a known clinical indicator. If your cholesterol is high, you're prescribed a drug, we can test it. And later on, we can determine whether or not it's working by that test. We also know if you're experiencing side effects, right? If the side effects, which are known for statins, are worse for you, then it might not be the right drug. It might be a good idea to try a different one. So with or without genomic testing, we can kind of narrow down these drugs. The same is true of proton pump inhibitors, right? You'll know if you're feeling better, if you've had relief from reflux, and you also know if your side effects are really undesirable. But when you use the same kind of thought process to consider medications for mental health, we don't have the same kind of clinical indicators that we do in the areas of cholesterol and reflux. It can be difficult to measure the response that you have to drugs used for some of the more significant mental health issues. These issues, such as anxiety, depression, or personality disorders, don't come with a lab test to determine whether or not your treatment is working as well as it could. How do you measure if you're less anxious or less depressed than the day before you took the pill, right? The other thing that's a challenge in regard is that many of these medications take some time before they reach the level in your body that's necessary to deliver the desired outcome. For example, drugs like Prozac, Paxil, Zoloft, often used for depression, usually require a week or two before they can be evaluated for success. Now, for that 2 weeks before you can really determine whether the drug is successful, you're probably going to experience some side effects. And very frequently, you're told to be patient during this period of time. If after 2 weeks you're still not feeling as well as you could, the prescriber may choose to increase your dosage and wait another 2 weeks to determine whether or not the new dosage is working. If you had a partial effect, he may raise again your dosage or wait for another 2 weeks while you're experiencing all those side effects and while you're having poor quality of life, and frankly, while you've paid for a bunch of drugs that may not have needed. This can go on, and the trial and error can go back and forth between a number of different medications, all while you're experiencing all of the ill events from this. The fact is, if we had PGX tests on board and the results before you needed these medications, we'd really be able to narrow the choice based on your personal genomic makeup. Just think of how much better it would be we would be able to pick those medications for you based on what we know about the enzymes that your body requires to activate those drugs and then to clear them out of your system. These medications really have no specific clinical indicator to determine whether or not they're succeeding, or other than how you feel. Prior to any diagnosis, this would have a remarkable effect on how we would treat you, your quality of life, and your success going forward. The same can be said for drugs that are used for anxiety. These medications are often controlled substances such as Xanax or Valium. These medications have with them a number of side effects such as drowsiness or dizziness, disorientation, which are really very undesirable. Wouldn't it be a better idea to avoid a trial and error with those drugs? Medications utilized for attention deficit disorder are also governed by enzymes revealed by a PGX test. I mean, how often have we heard children or even adults suffering from attention deficit disorder going through a number of drugs one by one to try and find the one that's best for them? Again, these agents have a lot of undesirable effects that are experienced throughout their use. Having a PGX test on board and the results would dramatically reduce the exposure to unnecessary drugs for attention deficit and relieve patients of some of the side effects along the way. If you're caring for a child having difficulty focusing or at school, knowing exactly what medications to choose if faced with attention deficit would be a tremendous relief to parents, the teachers, and the children that are suffering. The same is true of adults. Attention deficit disorder affects adults as well. But perhaps the greatest challenge in behavioral health and mental health is treating patients experiencing personality disorders. It's even more difficult to assess the success and the effectiveness of these medications. And for focusing on those suffering from personality disorders, every moment of the day can be anguish. As you can imagine, the understanding of the effectiveness of these medications is a tremendous challenge. The side effects of the drugs used to treat personality disorders can be very undesirable. In fact, lead to patients discontinuing the medications and giving up altogether. So in essence, PGS testing for mental health issues, as we've spoken of here, is an amazing and effective tool to help patients and prescribers avoid some of the stigma associated with them. We've talked a lot about the process of the test itself. It's a simple cheek swab followed by a laboratory examination, then a series of results that come back. But how exactly does a person get a PGX test? Well, the truth is, it's a clinical test, and it must be ordered by a physician. Your doctor has to order the test. The test then goes to a lab, and hopefully your insurance will pay for it. The physician may be required to provide your insurance with information about you and your diagnosis to get the test covered. Medicare pays for the test under a number of conditions. The first step is to speak with your physician. Let them know you're interested in genomic testing. Give them some of the information we've provided you here today. Ask them to write the order for the test and work with your insurance to get the test covered. Once this has taken place, ask that the results of the test be sent to Accessible Pharmacy Services. As your pharmacy provider, we will provide you with a comprehensive evaluation of the test and guidance going forward for any potential new issue that would benefit by the analysis. All Accessible Pharmacy clients are provided with a comprehensive clinical evaluation of their medications, including an examination of their relevance in regard to PGX testing. Becoming a client of Accessible Pharmacy Services will provide patients with access to a number of services, such as PGX examination, that are not necessarily available to them in other circumstances. If you're one of our clients, we can assist you through the process of getting the test. We can contact your physician. We can explain the process to your physician, and we can help evaluate the results of the test and share them with you. PGX testing and PGX evaluation and consultation is just a very small part of what we do on a daily basis. There are a number of other things in consultation and upkeep and discussions with your prescribers and continuity that provide real assistance in addressing mental health issues, especially for those patients that are affected by mental health, but also other internal medication issues such as diabetes and cholesterol and heart disease. That's really the thing to focus here, is that if you have a mental health issue, it doesn't forgive you from other things. People that have depression, they still have cholesterol too. People that have anxiety, well, they still have blood pressure issues too. And it's a very important thing that we provide, is the continuity of bringing all of these thoughts together so that you have a comprehensive solution and the assistance that you need, both from the perspective of how we pack your medications, how we provide them to you, and how we interact with your physicians to make sure that you're put in the best position to succeed. It's been a pleasure to discuss pharmacogenomics with you and the benefits it has to its mental health. Accessible Pharmacy Services is here for patients under any circumstance. Please don't hesitate to reach out to us, and we'd love to have you as a patient. Thank you all.
Thanks, Jason. Jason is awesome.